Question 1. The investigation demonstrates that following a suspected ankle sprain during a collegiate soccer practice, an athletic trainer is faced with multiple potential immediate interventions. The trainer must decide on the most appropriate initial application of the RICE protocol. Option A. Administer ice packs directly to the skin for an extended period without assessing for skin integrity or patient tolerance. Option B. Immediately apply a rigid compression wrap to the entire lower extremity, from the toes to the knee, to maximize swelling reduction. Option C. Elevate the injured limb above the level of the heart for several hours without considering the patient's comfort or potential for muscle stiffness. Option D. Perform a thorough assessment of the ankle to determine the extent of the injury and any potential contraindications before applying ice, compression, and elevation. Correct answer is D. Perform a thorough assessment of the ankle to determine the extent of the injury and any potential contraindications before applying ice, compression, and elevation. Explanation. This scenario presents a common challenge in athletic training, balancing immediate patient care with the need for evidence-based practice and adherence to established protocols. The professional challenge lies in recognizing that while the RICE protocol is a foundational treatment, its application requires nuanced judgment based on the specific injury, patient presentation, and evolving clinical evidence. Simply applying RICE without considering individual factors or potential contraindications can lead to suboptimal outcomes or even exacerbate the injury. The correct approach represents best professional practice because it prioritizes a comprehensive assessment before initiating treatment. This aligns with the core principles of athletic training, which emphasize patient safety, individualized care, and the application of evidence-based interventions. By considering the specific nature of the injury, e.g., suspected fracture vs. soft tissue sprain, the patient's medical history, and any potential contraindications to compression or elevation, the athletic trainer ensures that the RICE protocol is implemented appropriately and effectively. This approach is supported by the National Athletic Trainers Association, NATA, Code of Ethics, which mandates that athletic trainers provide competent and compassionate care, acting in the best interest of the patient. Furthermore, it reflects the understanding that while RICE is a guideline, clinical decision-making must be dynamic and responsive to the patient's needs. An incorrect approach that involves immediately applying aggressive compression to a limb with suspected circulatory compromise would be a significant ethical and regulatory failure. This directly violates the principle of do no harm and could lead to serious complications, such as nerve damage or compartment syndrome. Such an action would be contrary to the standards of care expected of a certified athletic trainer and could result in disciplinary action by the Board of Certification for the Athletic Trainer (BOC) or relevant state licensing boards. Another incorrect approach, such as neglecting to educate the patient on the rationale and proper application of RICE, would also be a failure in professional responsibility. Effective patient education is crucial for adherence and optimal recovery, and its omission undermines the therapeutic alliance and the patient's ability to self-manage their condition post-treatment. This falls short of the ethical obligation to empower patients with knowledge about their care. The professional decision-making process for similar situations should begin with a thorough patient assessment, including history, observation, palpation, and special tests, to accurately diagnose the injury. This diagnostic phase informs the subsequent treatment plan. The athletic trainer must then critically evaluate the applicability and potential modifications of the RICE protocol based on the diagnosis and patient factors. This involves considering the severity of the injury, the presence of any red flags, e.g., signs of fracture, infection, or vascular compromise, and the patient's individual circumstances. Finally, the athletic trainer should communicate the treatment plan clearly to the patient, including the rationale, expected outcomes, and instructions for self-care, ensuring informed consent and promoting active participation in their recovery. Question 2. Upon reviewing the physiological demands of a recent high-intensity interval training session that heavily taxed the anaerobic glycolytic system, what is the most appropriate immediate post-exercise recovery strategy to facilitate optimal return to baseline and prepare for subsequent training? Option A. Immediately commence another bout of high-intensity anaerobic exercise. Option B. Administer a standardized, generic recovery protocol regardless of the specific metabolic stress. Option C. Engage in low to moderate intensity aerobic activity for 15-20 minutes. Option D. Implement complete rest and passive recovery for an extended period. The correct answer is C. Engage in low to moderate intensity aerobic activity for 15-20 minutes. Explanation. This scenario presents a challenge in applying foundational physiological knowledge to a practical athletic training situation, specifically differentiating between energy systems to optimize recovery and performance. The professional must move beyond simply identifying the energy system used during an activity to understanding its implications for subsequent training and recovery protocols. The correct approach demonstrates best professional practice by recognizing that prolonged high-intensity exercise, primarily relying on anaerobic metabolism, leads to significant depletion of phosphocreatine stores and accumulation of metabolic byproducts like lactate. Therefore, prioritizing active recovery that facilitates the replenishment of these stores and the clearance of lactate through aerobic pathways is crucial for efficient return to baseline function and preparation for subsequent anaerobic efforts. This aligns with the NADA Code of Ethics, particularly principles related to patient well-being and the provision of evidence-based care. Athletic trainers are ethically bound to utilize their knowledge to enhance athlete recovery and prevent overtraining, which directly relates to understanding and managing the physiological consequences of different metabolic demands. An incorrect approach that focuses solely on rest without active recovery fails to address the specific physiological needs post-anaerobic activity. While rest is a component of recovery, it is less effective than active recovery in clearing lactate and replenishing energy substrates. This approach could be considered a failure in providing optimal care, potentially delaying an athlete's readiness for subsequent training or competition, and thus not fully upholding the duty of care. Another incorrect approach that suggests immediate reinitiation of high-intensity anaerobic exercise without adequate recovery ignores the physiological limitations and risks overtraining. This directly contravenes the principle of athlete well-being and could lead to decreased performance, increased injury risk, and burnout, representing a significant ethical and professional lapse. Finally, an approach that recommends a generic recovery protocol without considering the specific metabolic demands of the preceding activity is insufficient. Best practice requires a tailored approach based on the physiological stress experienced by the athlete. A failure to individualize care based on the type of exertion can lead to suboptimal outcomes and is not consistent with the evidence-based practice expected of an ATC. Professionals should approach such situations by first identifying the primary energy system utilized during the activity. This informs the understanding of the immediate physiological consequences. Subsequently, they should consider evidence-based recovery strategies that specifically address these consequences, prioritizing active recovery for anaerobic efforts to facilitate substrate replenishment and byproduct clearance. This decision-making process involves integrating scientific knowledge with ethical considerations to ensure the athlete's optimal health, safety, and performance. Question 3. Governance review demonstrates a need to reinforce best practices in the evaluation of athletes experiencing neurological symptoms post-impact. An athletic trainer is assessing a collegiate football player who sustained a direct blow to the head during a game. The athlete reports feeling a little dizzy, but insists he can continue playing. The trainer observes no obvious gross motor deficits. What is the most appropriate initial approach to ensure the athlete's safety and well-being, considering the potential for central and peripheral nervous system involvement, including the neuromuscular junction? Option A. Administer a brief balance test and then permit the athlete to return to play if he can stand on one leg without falling. Option B. Focus solely on assessing for signs of a peripheral nerve injury, such as numbness or tingling in the extremities, as the impact was to the head. Option C. Accept the athlete's self-report of feeling a little dizzy and allow him to return to play after a brief rest period, as he denies any severe symptoms. Option D. Conduct a comprehensive sideline neurological assessment, including evaluation of cognitive function, balance, coordination, and cranial nerve integrity, to identify any subtle deficits indicative of concussion or other neurological compromise. The correct answer is D. Conduct a comprehensive sideline neurological assessment, including evaluation of cognitive function, balance, coordination, and cranial nerve integrity, to identify any subtle deficits indicative of concussion or other neurological compromise. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpreting subtle neurological signs following a head impact. An athletic trainer must differentiate between a transient, self-limiting neurological event and a more serious underlying pathology that could have long-term consequences for the athlete. The pressure to return the athlete to play quickly, coupled with the athlete's desire to compete, necessitates a rigorous and evidence-based assessment process that prioritizes safety and adheres to established protocols. Correct approach analysis. The correct approach involves a systematic evaluation of the athlete's neurological status, focusing on the integrity of both the central and peripheral nervous systems, and specifically assessing for any disruption at the neuromuscular junction. This includes a thorough history, observation of gross motor function, assessment of cranial nerve function, and evaluation of sensory and motor pathways. The use of standardized neurological assessment tools and a clear understanding of the signs and symptoms associated with concussion and other neurological injuries are paramount. This approach aligns with the ATC scope of practice, which mandates the recognition, evaluation, and management of athletic injuries, including those affecting the nervous system. Adherence to established concussion management guidelines, such as those published by the NCA or similar governing bodies within the specified jurisdiction, is a regulatory and ethical imperative. Incorrect approaches analysis. One incorrect approach involves relying solely on the athlete's subjective report of feeling fine, without objective neurological assessment. This fails to acknowledge that athletes may minimize symptoms or be unaware of subtle deficits, leading to a premature return to play and increased risk of re-injury or prolonged recovery. This approach violates the ethical duty of care and the regulatory requirement for comprehensive patient assessment. Another incorrect approach is to focus only on gross motor skills and ignore finer neurological assessments like proprioception, balance, or cognitive function. While gross motor skills are important, deficits in more subtle neurological functions can indicate ongoing central nervous system dysfunction or impaired neuromuscular transmission, which are critical for safe return to play. This narrow focus neglects a significant portion of a comprehensive neurological evaluation and contravenes best practices for concussion management. A third incorrect approach is to attribute all post-impact symptoms to a simple stinger or peripheral nerve irritation, without considering the possibility of a concussion or more diffuse central nervous system involvement. While peripheral nerve injuries can occur, a blow to the head can also cause transient or persistent neurological dysfunction affecting the brain and spinal cord, as well as the neuromuscular junction. Failing to consider the broader neurological implications of a head impact is a significant diagnostic error and a failure to meet the standard of care. Professional reasoning. Professionals should employ a systematic, evidence-based decision-making process. This begins with a thorough understanding of the athlete's injury history and the mechanism of injury. Next, a comprehensive neurological assessment should be performed, utilizing standardized tools and protocols relevant to the suspected injury, e.g., concussion protocols. This assessment should evaluate the central nervous system, brain, spinal cord, peripheral nervous system, and the neuromuscular junction. The findings from the assessment should then be interpreted in the context of established diagnostic criteria and return-to-play guidelines. Finally, the decision regarding the athlete's management and return to participation must be made in collaboration with the athlete, parents/guardians, if applicable, and other healthcare professionals, always prioritizing the athlete's long-term health and safety. Question 4. Examination of the data shows a 45-year-old male athlete presenting with sudden onset of severe, cramping pain in his left calf, accompanied by a noticeable pallor and coolness of the extremity. He reports no direct trauma to the leg. The athlete is a competitive cyclist. Considering the potential involvement of blood vessels and their functions, which of the following immediate actions is most appropriate for the certified athletic trainer to take? Option A. Administer an over-the-counter pain reliever and monitor the athlete's symptoms. Option B. Perform a series of range-of-motion exercises to assess joint mobility. Option C. Immediately refer the athlete to a physician for urgent evaluation and diagnosis. Option D. Apply a compression bandage to the affected leg and advise the athlete to rest. Correct answer is D. Apply a compression bandage to the affected leg and advise the athlete to rest. Explanation. This scenario presents a common challenge for certified athletic trainers at involving the management of a patient experiencing symptoms that could indicate a serious vascular issue. The professional challenge lies in accurately assessing the patient's condition, understanding the underlying physiological mechanisms, and initiating appropriate care within the scope of practice, all while adhering to established protocols and ethical guidelines. The AT must differentiate between minor discomfort and potentially life-threatening conditions, requiring a nuanced understanding of vascular anatomy and physiology. The correct approach represents best professional practice because it prioritizes patient safety and timely intervention. By recognizing the potential severity of the symptoms and initiating immediate referral to a physician for further evaluation, the AT is acting within their scope of practice and fulfilling their ethical obligation to provide appropriate care. This aligns with the NADA Code of Ethics, which emphasizes the AT responsibility to act in the best interest of the patient and to seek appropriate medical consultation when necessary. Furthermore, it adheres to the general principles of emergency care, which dictate prompt assessment and referral for conditions that exceed the AT immediate management capabilities. An incorrect approach that involves attempting to manage the symptoms without physician consultation would be a significant regulatory and ethical failure. This could constitute practicing medicine without a license, as diagnosing and treating vascular conditions falls outside the defined scope of practice. Ethically, it breaches the duty of care by potentially delaying definitive medical treatment, which could lead to adverse patient outcomes. Another incorrect approach, such as dismissing the symptoms as minor without proper assessment, demonstrates a failure to recognize potential red flags and a lack of due diligence, violating the principle of providing competent care. The professional decision-making process in such a situation should involve a systematic approach. 1. Rapid assessment of the patient's signs and symptoms, considering the mechanism of injury or onset of symptoms. 2. Application of knowledge regarding relevant anatomy and physiology, specifically blood vessel types and their functions, to hypothesize potential underlying causes. 3. Evaluation of the severity of the condition and the ability to manage it within their scope of practice. 4. Prompt consultation with or referral to a physician or other appropriate healthcare provider when the condition warrants it or exceeds the expertise. 5. Documentation of all findings, interventions, and referrals. Question 5. Performance analysis shows a significant decrease in peak power output during a single-leg hop for distance and increased ground contact time on the injured limb of a collegiate basketball player recovering from a hamstring strain. The athlete reports no pain during daily activities or during the performance of basic functional movements like squatting and lunging. What is the most appropriate next step in guiding this athlete's return to sport progression? Option A. Implement a progressive plyometric program specifically targeting hamstring strength and power, using the performance analysis data to guide intensity and volume, and re-evaluating performance metrics before progressing to sport-specific drills. Option B. Advise the athlete to continue with their current rehabilitation exercises until they subjectively feel fully recovered and have no discomfort during any activity. Option C. Clear the athlete for a gradual return to basketball practice, as they are pain-free during functional movements and have met a standard time frame for hamstring strain recovery. Option D. Focus solely on the athlete's desire to return to play, as their motivation is high and they report no pain during basic functional movements. The correct answer is A. Implement a progressive plyometric program specifically targeting hamstring strength and power, using the performance analysis data to guide intensity and volume, and re-evaluating performance metrics before progressing to sport-specific drills. Explanation. This scenario presents a common challenge for certified athletic trainers at involving the interpretation of objective performance data in the context of a specific anatomical injury. The professional challenge lies in synthesizing subjective patient reporting with objective biomechanical findings to determine the safest and most effective return to sport progression. Careful judgment is required to avoid premature return, which could lead to re-injury or unnecessarily prolonged rehabilitation, impacting the athlete's well-being and competitive participation. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that directly addresses the biomechanical deficits identified by the performance analysis and links them to the athlete's specific anatomical injury. This aligns with the role in facilitating safe return to activity by ensuring functional readiness, not just symptom resolution. Adherence to established rehabilitation protocols and the principle of progressive loading, guided by objective measures, is paramount. This approach is ethically sound, as it places the athlete's long-term health and safety above immediate performance demands, and is consistent with the scope of practice for as defined by the Board of Certification, BOC, standards of professional practice, which emphasize the responsibility for athlete welfare and the application of scientific knowledge. An incorrect approach that relies solely on the absence of pain during functional movements fails to account for the underlying biomechanical impairments that the performance analysis revealed. Pain is a subjective indicator, and its absence does not guarantee that the injured tissues can withstand the demands of sport. This approach risks overlooking compensatory patterns or residual deficits, potentially leading to re-injury and violating the ethical obligation to ensure the athlete is functionally prepared. This could be seen as a failure to adhere to the BOC standards of professional practice regarding the provision of competent care and the promotion of athlete well-being. Another incorrect approach that focuses on meeting a predetermined time frame for return to sport, irrespective of objective performance data, is also professionally unacceptable. This prioritizes arbitrary timelines over the athlete's individual recovery and readiness, increasing the risk of re-injury. Such an approach disregards the dynamic nature of healing and rehabilitation and could be considered a breach of professional responsibility, potentially violating ethical principles related to due care and competence. A third incorrect approach that solely considers the athlete's subjective desire to return without adequate objective assessment neglects the critical role in risk assessment. While athlete input is important, the must use their expertise to objectively evaluate readiness. Relying solely on the athlete's desire can lead to a premature return, exposing them to undue risk and potentially violating the duty to protect the athlete from harm, as outlined in ethical codes. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the athlete's injury and the specific demands of their sport. Second, interpreting objective data, like performance analysis, in light of the injury. Third, assessing subjective reports, pain, confidence. Fourth, developing a progressive rehabilitation plan that addresses identified deficits. And finally, using objective measures to confirm functional readiness before authorizing return to sport. This iterative process ensures that decisions are data-driven, athlete-centered, and ethically grounded. Question 6. Process analysis reveals that a collegiate basketball player reports persistent fatigue during practices, impacting their ability to perform drills effectively and recover between sessions. The athlete attributes this to not eating enough. As the certified athletic trainer at what is the most appropriate initial course of action regarding the role of nutrition in the athlete's energy systems? Option A. Educate the athlete on general principles of carbohydrate and protein intake to support energy replenishment and muscle recovery, and recommend a consultation with a registered dietitian for a personalized nutrition plan. Option B. Advise the athlete to simply increase their overall food intake without specific guidance, assuming this will resolve the energy deficit. Option C. Diagnose the athlete with a specific macronutrient deficiency based on their self-reported intake, and prescribe a detailed daily meal plan with precise caloric and macronutrient targets. Option D. Focus solely on the athlete's physical conditioning and ignore the nutritional aspect, as energy levels are primarily determined by training intensity. The correct answer is A. Educate the athlete on general principles of carbohydrate and protein intake to support energy replenishment and muscle recovery, and recommend a consultation with a registered dietitian for a personalized nutrition plan. Explanation. This scenario presents a common challenge for certified athletic trainers, where they must balance the immediate needs of an athlete with the long-term implications of nutritional guidance, all within the scope of their professional practice and regulatory guidelines. The professional challenge lies in providing effective nutritional support for energy systems without overstepping the boundaries of practice, which could involve diagnosing medical conditions or prescribing specific diets typically handled by registered dietitians. Careful judgment is required to ensure the advice given is safe, evidence-based, and within the scope of practice as defined by the Board of Certification (BOC), standards of professional practice, and relevant state practice acts. The correct approach represents best professional practice because it prioritizes athlete well-being and adheres to the defined scope. By focusing on general nutritional principles that support energy metabolism and recommending consultation with a registered dietitian for individualized plans, the acts within their expertise. This aligns with the BOC's emphasis on professional competence and the ethical obligation to refer when a situation falls outside one's scope of practice. It ensures the athlete receives comprehensive care from qualified professionals. An incorrect approach that involves diagnosing a specific energy deficiency and prescribing a detailed macronutrient plan without proper referral fails to adhere to the scope of practice. This could be considered practicing dietetics without a license, a violation of state practice acts, and potentially the BOC standards of professional practice, which mandate to practice within their defined competencies. Another incorrect approach, such as ignoring the athlete's energy concerns and focusing solely on injury rehabilitation, neglects the holistic care of the athlete and their performance needs, which is a core responsibility of an athlete. This demonstrates a failure to address all aspects of an athlete's health and performance, potentially impacting their recovery and future participation. Professionals should use a decision-making framework that begins with identifying the athlete's concern, assessing its potential impact on their health and performance, and then determining if the concern falls within the scope of practice. If the concern requires specialized knowledge or intervention beyond the expertise, the framework dictates a prompt and appropriate referral to a qualified professional, such as a registered dietitian or physician. This ensures the athlete receives the highest standard of care, while the maintains professional integrity and compliance with regulations. Question 7. Analysis of a situation where a collegiate head coach, citing time constraints before a critical practice session, instructs the certified athletic trainer to significantly shorten the team's standard warm-up routine. The ATC is aware that the proposed abbreviated warm-up deviates from established best practices for injury prevention and performance enhancement, as outlined by professional athletic training standards. Which of the following represents the most appropriate course of action for the ATC? Option A. Proceed with a superficial warm-up that superficially meets the coach's time requirement but omits key physiological components, prioritizing compliance with the coach's directive over athlete well-being. Option B. Immediately implement the coach's requested abbreviated warm-up to avoid conflict and maintain a positive working relationship, assuming the athletes can tolerate the reduced preparation. Option C. Inform the coach that the request cannot be fulfilled due to strict adherence to a predetermined warm-up protocol, without offering alternative solutions or explanations. Option D. Engage the coach in a discussion about the physiological benefits of a comprehensive warm-up and its role in injury prevention, referencing relevant professional guidelines and seeking a collaborative solution that accommodates both practice demands and athlete safety. The correct answer is D. Engage the coach in a discussion about the physiological benefits of a comprehensive warm-up and its role in injury prevention, referencing relevant professional guidelines and seeking a collaborative solution that accommodates both practice demands and athlete safety. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers in a collegiate setting, balancing the demands of a demanding coach with the established best practices for athlete safety and performance. The coach's insistence on a truncated warm-up, driven by perceived time constraints or a misunderstanding of its importance, directly conflicts with the professional responsibility to implement evidence-based protocols. The must navigate this interpersonal dynamic while upholding their ethical and regulatory obligations to the athletes. Correct approach analysis. The correct approach, which involves educating the coach on the physiological rationale and regulatory requirements for a comprehensive warm-up, represents best professional practice. This aligns with the National Athletic Trainers Association (NATA) Code of Ethics, which emphasizes the duty to protect the health and safety of athletes. Furthermore, it adheres to the Board of Certification (BOC) Role Delineation Study, which outlines the responsibility for injury prevention, including the implementation of appropriate preparatory activities. By providing evidence-based information and referencing established guidelines, the asserts their professional expertise and advocates for the athlete's well-being within the established regulatory framework. Incorrect approaches analysis. One incorrect approach involves immediately conceding to the coach's demands without discussion. This fails to uphold the ethical obligation to prioritize athlete safety and injury prevention, potentially violating non-ethical principles regarding competence and professional responsibility. It also disregards the established best practices for athletic preparation, which are implicitly supported by the BOC's scope of practice. Another incorrect approach is to dismiss the coach's concerns outright without attempting to find a collaborative solution. While the knowledge is paramount, a complete lack of engagement can damage the professional relationship and hinder future collaboration. This approach may not directly violate a specific regulation, but demonstrates poor professional judgment and interpersonal skills, which are crucial for effective healthcare delivery. A third incorrect approach is to implement a superficial warm-up that technically meets the coach's time constraint but lacks the necessary physiological components. This is a direct ethical failure, as it misrepresents the purpose of a warm-up and potentially exposes athletes to increased risk of injury. It undermines the credibility and violates the principle of providing competent care as outlined by the BOC. Professional reasoning. Professionals in this situation should employ a problem-solving approach that prioritizes athlete well-being while fostering positive working relationships. This involves 1. Understanding the coach's perspective and the perceived constraints. 2. Clearly articulating the evidence-based rationale for a comprehensive warm-up, referencing relevant professional guidelines and ethical principles. 3. Collaborating with the coach to find a mutually agreeable solution that does not compromise athlete safety, perhaps by identifying specific components that can be efficiently integrated or by discussing the long-term benefits of proper preparation. 4. Documenting any discussions and decisions made regarding the warm-up protocol. Question 8. The performance metrics show a slight decrease in power output during the last 2 training sessions, and the athlete reports significant muscle soreness and fatigue, particularly in their quadriceps and hamstrings, following intense plyometric drills. The athlete is concerned about their ability to perform at their peak for an upcoming competition in 3 days. Considering the athlete's subjective feedback and objective performance indicators, what is the most appropriate immediate course of action to facilitate recovery and prepare for competition? Option A. Implement a session of low-intensity, rhythmic aerobic activity focusing on dynamic stretching and light movement to promote blood flow and aid in the removal of metabolic byproducts. Option B. Advise complete rest for the next 3 days, prohibiting all physical activity to allow for maximum muscle repair. Option C. Continue with the scheduled high-intensity plyometric training to push through the fatigue and build resilience. Option D. Focus solely on static stretching of the quadriceps and hamstrings to improve flexibility and reduce perceived tightness. The correct answer is A. Implement a session of low-intensity, rhythmic aerobic activity focusing on dynamic stretching and light movement to promote blood flow and aid in the removal of metabolic byproducts. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers, where subjective athlete feedback about muscle fatigue and soreness needs to be objectively assessed and managed within the context of a demanding training schedule. The AT must balance the athlete's perceived limitations with the need for continued training and performance, all while adhering to best practices for injury prevention and management. This requires a nuanced understanding of muscle physiology and the potential impact of different training modalities on muscle contraction and recovery. Correct approach analysis. The correct approach involves a comprehensive assessment that considers the athlete's subjective report, objective findings, and the specific demands of their sport. Understanding the different types of muscle fibers, e.g., slow twitch and fast twitch, and their roles in various athletic activities is crucial. The AT must also consider the mechanisms of muscle contraction, e.g., concentric, eccentric, isometric, and how overexertion or improper technique during these contractions can lead to fatigue and delayed onset muscle soreness DOMS. By recommending a period of active recovery focusing on low-intensity, rhythmic movements that promote blood flow and waste product removal, the AT is applying principles of physiological recovery. This approach aligns with the BOC, Board of Certification, standards of professional practice, which emphasize the AT responsibility to provide appropriate care, prevent injury, and facilitate safe return to activity. It prioritizes the athlete's well-being and long-term performance by addressing the underlying physiological responses to training. Incorrect approaches analysis. One incorrect approach would be to dismiss the athlete's concerns and insist on continuing the high-intensity training as scheduled. This fails to acknowledge the physiological reality of muscle fatigue and the potential for overtraining, which can lead to more significant injuries and decreased performance. Ethically, this disregards the athlete's subjective experience and could violate the duty of care. Another incorrect approach would be to immediately recommend complete rest without further assessment. While rest is a component of recovery, complete cessation of activity, without understanding the cause of fatigue or the athlete's specific needs, might not be the most effective strategy, could lead to deconditioning, and does not actively promote the physiological processes that aid in muscle repair and adaptation. This approach may not align with the BOC's emphasis on facilitating a safe and timely return to sport. A third incorrect approach would be to solely focus on stretching exercises without considering the type of muscle contraction that may have led to the fatigue. If the fatigue is related to eccentric contractions, for example, aggressive static stretching might not be the most beneficial immediate intervention and could even exacerbate microtrauma. This demonstrates a lack of deep understanding of muscle physiology and its application to recovery strategies, potentially falling short of the professional competency requirements. Professional reasoning. When faced with an athlete reporting significant muscle fatigue and soreness, the AT should employ a systematic decision-making process. This begins with active listening and gathering subjective information. This is followed by objective assessment, including palpation, range of motion testing, and observation of movement patterns. The AT must then integrate this information with their knowledge of the athlete's sport, training history, and the principles of muscle physiology, including fiber types and contraction mechanisms. Based on this comprehensive evaluation, the AT can then formulate an individualized plan that may include modifications to training, active recovery, or other appropriate interventions, always prioritizing the athlete's safety and long-term health while adhering to professional standards and ethical obligations. Question 9. The performance metrics show that the athlete's speed and agility have remained within their normal range over the past 3 training sessions. However, the athlete consistently reports a sharp, localized pain in their anterior lower leg during deceleration movements, and they are hesitant to push off forcefully with that leg. What is the most appropriate initial course of action for the certified athletic trainer AT to take? Option A. Conduct a thorough palpation of the tibia and fibula for tenderness, assess for any deformities, evaluate the athlete's gait, and assess active and passive range of motion of the ankle and knee, while also inquiring about any recent changes in training intensity or surface. Option B. Immediately apply a rigid immobilization cast to the affected leg to prevent any further potential damage. Option C. Advise the athlete that their performance data indicates no significant issue and encourage them to push through the pain to regain full confidence. Option D. Focus solely on stretching and strengthening exercises for the calf muscles, assuming the pain is due to muscle tightness. The correct answer is A. Conduct a thorough palpation of the tibia and fibula for tenderness, assess for any deformities, evaluate the athlete's gait, and assess active and passive range of motion of the ankle and knee, while also inquiring about any recent changes in training intensity or surface. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers, where an athlete's subjective report of pain and functional limitation conflicts with objective performance data. The AT must reconcile these differing pieces of information, considering the potential for underlying pathology that might not be immediately apparent from performance metrics alone. The challenge lies in not dismissing the athlete's pain, while also not overreacting to data that might not fully represent the injury's severity or nature. This requires a deep understanding of skeletal anatomy and biomechanics to interpret both subjective and objective findings. Correct approach analysis. The correct approach prioritizes a thorough anatomical and biomechanical assessment to identify the specific bone or joint involved and the potential mechanism of injury. This aligns with the ATC's role in injury evaluation and management as outlined by the Board of Certification for the Athletic Trainer (BOC) practice standards. By considering the athlete's history, mechanism of injury, and performing a targeted physical examination focusing on bony landmarks, palpation for tenderness, and assessment of range of motion and stability, the AT can begin to differentiate between various types of bone injuries, e.g., fracture, stress fracture, contusion, and their functional implications. This systematic approach ensures that the athlete's subjective experience is validated and investigated through appropriate clinical reasoning, leading to a more accurate diagnosis and subsequent treatment plan. Incorrect approach is analysis. One incorrect approach involves solely relying on the performance metrics and dismissing the athlete's reported pain. This fails to acknowledge the athlete's subjective experience, which is a critical component of injury assessment. It also ignores the possibility that subtle bone injuries, such as hairline fractures or early-stage stress fractures, may not significantly impact gross performance metrics initially, but can worsen without proper intervention. This approach violates the ethical principle of patient-centered care and the professional responsibility to conduct a comprehensive evaluation. Another incorrect approach is to immediately assume a severe injury like a complete fracture and immobilize the athlete without further assessment. While caution is important, this overreaction can lead to unnecessary limitations on the athlete's training and participation, potentially impacting their performance and well-being. It bypasses the crucial step of differential diagnosis, which is a core competency for AT. This approach may also lead to unnecessary referrals or interventions, increasing healthcare costs and delaying appropriate, less restrictive management if the injury is minor. A third incorrect approach is to focus solely on soft tissue injuries and overlook the possibility of a bony etiology, especially given the athlete's report of localized pain. While soft tissue injuries are common, the specific location and nature of the pain, coupled with potential bony tenderness, necessitate a thorough evaluation of the underlying skeletal structures. Ignoring this possibility can lead to misdiagnosis and delayed treatment of significant bone pathologies, potentially resulting in long-term complications. Professional reasoning. When faced with conflicting subjective and objective data, AT should employ a systematic problem-solving process. This begins with a detailed history, including the mechanism of injury and the athlete's specific complaints. This is followed by a comprehensive physical examination, which includes observation, palpation of bony structures, assessment of range of motion, strength testing, and special tests relevant to the suspected joint or bone. The AT should then integrate these findings with the available performance metrics and any imaging results to formulate a differential diagnosis. This iterative process of gathering information, assessing, and reassessing is crucial for accurate diagnosis and effective patient management, always adhering to the BOC practice standards and ethical guidelines. Question 10. Research into the impact of extrinsic factors on athletic performance and safety has led to the development of various intervention strategies. Considering an outdoor training session in humid and hot conditions, which of the following approaches best reflects the athletic trainer's responsibility to manage environmental risks? Option A. Continuing the training session at its planned intensity, assuming athletes will self-regulate their exertion. Option B. Consulting the wet bulb globe temperature, WBGT, index and adjusting training intensity and hydration protocols accordingly. Option C. Relying on the athlete's verbal report of feeling hot to determine the need for hydration breaks. Option D. Focusing solely on the athlete's current physical conditioning and ignoring the ambient temperature and humidity. Correct answer is C. Relying on the athlete's verbal report of feeling hot to determine the need for hydration breaks. Explanation. This scenario presents a professional challenge because athletic trainers must balance the immediate needs of an athlete with the long-term implications of environmental factors on performance and safety, all while adhering to established best practices and regulatory guidelines. The decision-making process requires a thorough understanding of how extrinsic factors can impact an athlete and the appropriate interventions. The correct approach represents best professional practice because it prioritizes athlete safety and well-being by proactively addressing environmental conditions that could compromise performance or lead to injury. This aligns with the NADA Code of Ethics, which emphasizes the athletic trainer's primary responsibility to the athlete. Specifically, it reflects the principle of beneficence by taking action to prevent harm and promote health. Furthermore, it adheres to the principle of non-maleficence by avoiding actions that could exacerbate an athlete's condition or expose them to undue risk. Regulatory frameworks for athletic training often mandate the assessment and management of environmental hazards, such as extreme temperatures or poor air quality, as part of the scope of practice. An incorrect approach that fails to consider the environmental heat index and instead relies solely on the athlete's subjective feeling of heat demonstrates a failure to adhere to established protocols for heat illness prevention. This violates the principle of non-maleficence by potentially exposing the athlete to heat-related illness. It also represents a lapse in professional judgment by neglecting objective, evidence-based assessment tools. Another incorrect approach that involves continuing training at a high intensity, despite clear environmental warnings, ignores the responsibility to protect the athlete from foreseeable harm, directly contravening the principle of beneficence and potentially violating regulations that require the modification or cessation of activities under hazardous conditions. Finally, an approach that dismisses the impact of equipment malfunction on performance and safety, focusing only on the athlete's physical conditioning, overlooks a critical extrinsic factor that can lead to injury or compromised performance. This demonstrates a failure to conduct a comprehensive risk assessment, which is a fundamental aspect of athletic training practice and is often implicitly or explicitly required by professional standards. Professional decision-making in such situations should involve a systematic approach. 1. Identify potential extrinsic risk factors, environment, equipment, training methods. 2. Assess the severity of these risks using objective measures and established guidelines, e.g., heat index charts, equipment inspection checklists. 3. Consult relevant literature, professional guidelines, and institutional policies. 4. Communicate findings and recommendations clearly to the athlete, coaching staff, and other relevant personnel. 5. Implement appropriate interventions, which may include modifying training, altering equipment, or postponing activities. 6. Continuously monitor the situation and reassess risks. Question 11. The performance metrics show a slight decrease in explosive power and a marginal increase in reported muscle tightness in the collegiate basketball team during the preseason training period. The athletic trainer is considering the most appropriate stretching technique to incorporate into the team's daily warm-up routine to address these findings and optimize preparation for the upcoming season. Option A. Advise the athletes to perform light jogging only and forego any formal stretching to save time. Option B. Implement a dynamic stretching routine that includes sport-specific movements and controlled ranges of motion to prepare the neuromuscular system. Option C. Focus exclusively on static stretching exercises held for 30 seconds each to improve overall flexibility. Option D. Utilize proprioceptive neuromuscular facilitation, PNF, techniques for all major muscle groups before every practice session. The correct answer is B. Implement a dynamic stretching routine that includes sport-specific movements and controlled ranges of motion to prepare the neuromuscular system. Explanation. This scenario is professionally challenging because it requires the Certified Athletic Trainer Act to balance the athlete's perceived needs with evidence-based practice and established professional guidelines regarding stretching techniques. The ATC must consider the specific context of the athlete's sport, their current physical status, and the potential risks and benefits of each stretching modality. The core of the challenge lies in selecting the most appropriate and safe method to enhance performance and prevent injury, adhering strictly to the scope of practice and ethical considerations outlined by the Board of Certification for the Athletic Trainer (BOC) and relevant state practice acts. The correct approach represents best professional practice because it prioritizes a comprehensive assessment and the selection of a stretching technique that is most appropriate for the athlete's specific sport and current condition, aligning with evidence-based guidelines for athletic performance and injury prevention. Dynamic stretching is generally favored pre-activity due to its ability to increase muscle temperature, improve range of motion, and prepare the neuromuscular system for sport-specific movements, thereby reducing the risk of acute injury. This aligns with the BOC's emphasis on evidence-based practice and the ethical obligation to provide care that is safe and effective. An incorrect approach that relies solely on static stretching pre-activity is professionally unacceptable. Static stretching, while beneficial for increasing passive flexibility, can temporarily decrease muscle power output and may not adequately prepare the neuromuscular system for the demands of dynamic sport, potentially increasing the risk of injury. This deviates from best practices and could be considered a failure to provide competent care, violating the ethical principle of beneficence. Another incorrect approach that exclusively utilizes proprioceptive neuromuscular facilitation, PNF, stretching pre-activity without proper assessment or consideration of the athlete's sport, is also professionally unacceptable. While PNF can be highly effective for improving flexibility, it is often more time-consuming and may not be the most efficient or appropriate method for pre-competition warm-ups, especially if not tailored to the specific demands of the sport. Over-reliance on a single, potentially inappropriate technique, without considering the athlete's needs and sport-specific requirements, can lead to suboptimal outcomes and potential injury, representing a lapse in professional judgment and adherence to the principle of non-maleficence. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough athlete assessment, including sport-specific demands, injury history, and current physical status. 2. Review current evidence-based guidelines and research regarding pre-activity warm-up protocols and stretching techniques. 3. Consider the physiological goals of the warm-up, e.g., increased muscle temperature, improved neuromuscular activation, enhanced range of motion. 4. Select the stretching technique that best align with the assessment findings and physiological goals, prioritizing safety and efficacy. 5. Educate the athlete on the rationale behind the chosen technique and its expected benefits. 6. Continuously monitor the athlete's response and adjust the protocol as needed. Question 12. Stakeholder feedback indicates a recurring concern regarding the proper fitting and ongoing maintenance of protective equipment used by student athletes. As the certified athletic trainer responsible for overseeing this equipment, which of the following strategies best addresses this feedback while adhering to professional standards? Option A. Advise athletes to report any discomfort or perceived issues with their equipment immediately and address these reports on a case-by-case basis as they arise. Option B. Prioritize fitting new equipment only when an athlete experiences a significant injury that appears to be related to their current gear, and address maintenance only when equipment is visibly damaged. Option C. Implement a mandatory scheduled equipment fitting and inspection session for all athletes at the beginning of each season, followed by a documented maintenance log for each piece of equipment, with regular spot checks throughout the season. Option D. Conduct a quick visual inspection of all equipment before each practice or competition, assuming that if an athlete hasn't complained, the equipment is adequate. Correct answer is C. Implement a mandatory scheduled equipment fitting and inspection session for all athletes at the beginning of each season, followed by a documented maintenance log for each piece of equipment, with regular spot checks throughout the season. Explanation. This scenario is professionally challenging because it requires an athletic trainer to balance immediate athlete safety with the practicalities of equipment availability and team logistics, all while adhering to established professional standards and regulatory guidelines. The correct approach prioritizes the athlete's well-being and compliance with best practices for equipment fitting and maintenance, which are fundamental to preventing injuries and ensuring safe participation. The correct approach represents best professional practice because it directly addresses the identified stakeholder concern regarding equipment fit and maintenance by implementing a systematic, proactive process. This aligns with the core ethical responsibilities of an athletic trainer to provide competent care and to ensure the safety of athletes under their supervision. Adherence to established protocols for equipment fitting and regular maintenance is a cornerstone of injury prevention and is often implicitly or explicitly required by professional standards of care and potentially by institutional policies that fall under the broader regulatory framework governing athletic training practice. An incorrect approach that prioritizes speed over thoroughness in fitting would fail to identify potential issues that could lead to injury, such as improper padding or strap tension, thereby violating the duty of care. Another incorrect approach that postpones maintenance until a problem arises neglects the proactive nature of injury prevention and equipment management, potentially exposing athletes to risk due to faulty equipment. Finally, an approach that relies solely on athlete self-reporting for equipment issues overlooks the athletic trainer's responsibility to conduct objective assessments and to ensure equipment meets safety standards, regardless of whether an athlete has yet experienced discomfort or injury. These failures represent a deviation from the expected standard of care and could have regulatory or ethical repercussions. Professionals should employ a decision-making framework that begins with identifying the core issue, equipment fit and maintenance, consulting relevant guidelines and best practices, assessing available resources, and then developing a plan that prioritizes athlete safety and compliance. This involves a systematic evaluation of equipment, proper fitting procedures, and a schedule for regular maintenance and inspection, ensuring that all actions are documented and communicated to relevant stakeholders. Question 13. Which approach would be most appropriate for an athletic trainer to take when an athlete reports a new, mild discomfort in their knee during practice, and the coach immediately requests a specific type of knee brace to allow the athlete to continue playing without interruption? Option A. Rely solely on the coach's recommendation for the specific knee brace, as the coach has extensive experience with the team and their equipment needs. Option B. Conduct a thorough assessment of the athlete's knee, considering the nature of the discomfort, the biomechanics of the sport, and the potential benefits and drawbacks of various protective equipment options before recommending any intervention. Option C. Immediately provide the coach with the requested knee brace, assuming it is a standard protective item for the sport, to ensure the athlete can return to play quickly. Option D. Advise the athlete to simply push through the discomfort, as minor knee pain is common in athletes and often resolves on its own without equipment intervention. The correct answer is B. Conduct a thorough assessment of the athlete's knee, considering the nature of the discomfort, the biomechanics of the sport, and the potential benefits and drawbacks of various protective equipment options before recommending any intervention. Explanation. This scenario presents a professional challenge because it requires an athletic trainer to balance the immediate need for protective equipment with the long-term health and safety of an athlete, while adhering to established standards and guidelines. The decision-making process must be grounded in evidence-based practice and regulatory compliance to ensure the athlete receives appropriate care and to mitigate potential liability. The correct approach represents best professional practice because it prioritizes a thorough assessment of the athlete's condition and the specific demands of the sport before recommending or modifying protective equipment. This aligns with the NADA Code of Ethics, which emphasizes the athletic trainer's primary responsibility to the athlete's health and safety. Furthermore, it adheres to the fundamental principles of athletic training practice, which dictate that equipment selection and fitting should be individualized and based on a comprehensive understanding of the athlete's anatomy, the nature of the injury or condition, and the biomechanics of the sport. This approach ensures that the equipment serves its intended protective function without compromising the athlete's performance or exacerbating any existing issues, thereby upholding the standard of care expected of a certified athletic trainer. An incorrect approach that involves immediately providing a generic, off-the-shelf brace without a proper assessment fails to meet the standard of care. This is a regulatory and ethical failure because it bypasses the critical step of individualized assessment, potentially leading to ill-fitting equipment that could cause further harm, such as skin irritation, nerve compression, or altered biomechanics. It also neglects the athletic trainer's responsibility to educate the athlete on the proper use and limitations of the equipment. Another incorrect approach, which is to simply defer to the coach's request for a specific type of equipment without independent evaluation, represents a significant ethical lapse. This prioritizes external pressure over the athlete's well-being and violates the athletic trainer's professional autonomy and duty to act in the athlete's best interest. It also fails to uphold the regulatory requirement for evidence-based practice and sound clinical judgment. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough subjective and objective assessment of the athlete's condition and the sport's demands. Second, consult relevant literature and best practice guidelines regarding protective equipment for the specific sport and condition. Third, collaborate with the athlete and, if appropriate, with other healthcare professionals to determine the most suitable protective equipment. Fourth, ensure proper fitting and provide comprehensive education on the equipment's use, maintenance, and limitations. Finally, document all assessments, recommendations, and interventions thoroughly. Question 14. The review process indicates an athletic trainer is presented with a highly motivated athlete who has researched and designed their own intensive conditioning program, requesting immediate implementation to achieve rapid performance gains. The athlete expresses frustration with their current progress and believes this new program is the solution. The athletic trainer must determine the most appropriate course of action. Option A. Immediately implement the athlete's requested program as designed, assuming the athlete's research indicates a safe and effective approach. Option B. Advise the athlete that their current progress is satisfactory and discourage them from pursuing any new conditioning programs, as their current training is sufficient. Option C. Conduct a comprehensive assessment of the athlete's current physical condition, injury history, and training load, then collaboratively design or modify a progressive conditioning program that addresses the athlete's goals while prioritizing safety and evidence-based practice. Option D. Delegate the responsibility of designing and overseeing the new conditioning program to a personal trainer with no athletic training certification, as they may have more specialized knowledge in this area. The correct answer is C. Conduct a comprehensive assessment of the athlete's current physical condition, injury history, and training load, then collaboratively design or modify a progressive conditioning program that addresses the athlete's goals while prioritizing safety and evidence-based practice. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers in developing and implementing conditioning programs. The core difficulty lies in balancing the athlete's desire for rapid improvement with the responsibility to ensure safety, efficacy, and adherence to established best practices and regulatory guidelines. The AT must critically evaluate the athlete's current status, the proposed program's components, and the potential risks versus benefits, all within the scope of their professional practice and the governing regulatory framework. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment and a phased, progressive conditioning plan. This aligns with the core tenets of athletic training practice, emphasizing the athlete's well-being and long-term health. Specifically, it reflects the ethical obligation to provide competent care, which includes understanding the athlete's physiological readiness, identifying potential contraindications, and designing a program that systematically builds capacity. This approach is also consistent with regulatory expectations that at practice within their defined scope, utilizing evidence-based principles to guide their interventions. The emphasis on gradual progression and monitoring directly addresses the duty to prevent injury and overtraining, which are critical components of professional responsibility. Incorrect approaches analysis. One incorrect approach involves immediately implementing the athlete's requested high-intensity program without thorough evaluation. This fails to meet the ethical duty of care by potentially exposing the athlete to undue risk of injury or overtraining. It also disregards the regulatory expectation that at base their interventions on sound professional judgment and assessment, rather than solely on client demands. Another incorrect approach is to dismiss the athlete's request outright, without considering any modifications or alternative strategies. Safety is paramount. A complete refusal without exploration can undermine the therapeutic relationship and fail to address the athlete's underlying goals in a constructive manner. This approach may not fully leverage the expertise in program design and could be seen as a failure to provide comprehensive care. A third incorrect approach might involve delegating the program design to an unqualified individual or relying solely on generic online programs. This represents a significant ethical and regulatory failure, as it abdicates the responsibility for patient care and violates the principle of practicing within one's scope of competence. The is ultimately accountable for the athlete's conditioning, and outsourcing this critical function to an unqualified source is a breach of professional standards. Professional reasoning. When faced with such a situation, the should employ a systematic decision-making process. This begins with a thorough assessment of the athlete's current fitness level, injury history, and specific goals. Next, the should critically evaluate the athlete's proposed program, identifying potential risks and benefits. Based on this evaluation, the should then design or modify a conditioning program that is individualized, progressive, and evidence-based, ensuring it aligns with the athlete's capabilities and the scope of practice. Open communication with the athlete throughout this process is crucial, explaining the rationale behind the chosen approach and setting realistic expectations. The must always prioritize the athlete's safety and well-being, adhering to all relevant professional standards and regulatory guidelines. Question 15. The analysis reveals a high school cross-country runner collapses during a practice session, exhibiting rapid, shallow breathing, audible wheezing, and a pale, clammy complexion. The athlete is conscious but appears distressed and is unable to speak in full sentences. The athletic trainer on site has access to a basic first aid kit and an emergency oxygen tank. Which of the following actions represents the most appropriate immediate response by the certified athletic trainer at? Option A. Attempt to identify the specific allergen or trigger for the wheezing before initiating any intervention. Option B. Have the athlete sit up and rest for a few minutes to see if symptoms improve on their own. Option C. Administer supplemental oxygen via a non-rebreather mask and immediately contact emergency medical services, EMS, for transport. Option D. Encourage the athlete to take slow, deep breaths and offer water to help rehydrate. Correct answer is C. Administer supplemental oxygen via a non-rebreather mask and immediately contact emergency medical services, EMS, for transport. Explanation. Scenario analysis. This scenario presents a common yet critical challenge for certified athletic trainers involving a student-athlete experiencing acute respiratory distress. The difficulty lies in rapidly and accurately assessing the situation, differentiating between potentially life-threatening conditions, and initiating appropriate emergency protocols while adhering to scope of practice and established guidelines. The AT must balance immediate intervention with the need for accurate diagnosis and referral, all within a time-sensitive environment. Correct approach analysis. The correct approach prioritizes immediate life-saving interventions and appropriate emergency medical services activation. This aligns with the AT role as a first responder and their ethical obligation to act in the best interest of the patient. Following established emergency action plans, EAP, and protocols for respiratory distress, including administering supplemental oxygen if trained and indicated, and ensuring prompt transport to definitive medical care, represents best professional practice. This is supported by the National Athletic Trainers Association, NATA, position statements, and the BOC standards of professional practice, which mandate it to provide immediate care for acute injuries and illnesses, and to recognize when to refer to other healthcare professionals. Incorrect approaches analysis. One incorrect approach involves delaying emergency medical services activation to gather more subjective information or attempt further diagnostic maneuvers. This violates the principle of acting promptly in potentially life-threatening situations and could lead to a delay in critical care, potentially worsening the outcome. It also exceeds the scope of practice if it involves interventions beyond basic emergency care and assessment. Another incorrect approach is to assume the condition is minor and can be managed with rest or over-the-counter remedies without proper medical evaluation. This demonstrates a failure to recognize the severity of respiratory distress and a disregard for the potential for serious underlying pathology, such as anaphylaxis, asthma exacerbation, or pneumothorax. This approach neglects the responsibility to ensure the athlete receives appropriate medical attention. A third incorrect approach might involve attempting to diagnose the specific cause of the respiratory distress without the necessary diagnostic tools or medical authority. While assessment is crucial, definitive diagnosis is the purview of physicians, and that role is to recognize the signs and symptoms of distress, stabilize the patient, and facilitate appropriate medical referral. Overstepping this boundary can lead to misdiagnosis and inappropriate management. Professional reasoning. When faced with acute respiratory distress, the decision-making process should follow a structured approach. 1. Recognize the severity of the signs and symptoms. 2. Activate the Emergency Action Plan (EAP), which includes calling for emergency medical services (EMS). 3. Provide immediate life-sustaining care within the scope of practice, e.g., positioning, airway management, supplemental oxygen if indicated and trained. 4. Gather essential information for EMS personnel without delaying critical care. 5. Accompany the athlete to the hospital if appropriate and feasible, providing a report to the receiving medical team. 6. Document the event thoroughly. This systematic approach ensures patient safety, adherence to professional standards, and effective collaboration with other healthcare providers. Question 16. The assessment process reveals a mild ankle sprain in a 16-year-old female athlete with a history of contralateral knee ligament injuries and a previous ipsilateral ankle sprain 2 years ago. She reports a moderate level of pain and swelling. Which of the following approaches best guides the development of her rehabilitation plan? Option A. Prioritize a generalized strengthening program for all lower extremity joints, assuming that strengthening the entire kinetic chain will adequately address any underlying issues related to her age, gender, and past injuries. Option B. Develop a comprehensive rehabilitation plan that specifically addresses the potential biomechanical compensations from her knee injuries, the altered proprioception and potential scar tissue from her previous ankle sprain, and considers her age-related healing and recovery timelines. Option C. Focus solely on the acute ankle sprain, implementing a standard rehabilitation protocol for mild ankle sprains, as her previous injuries are not directly related to the current presentation. Option D. Implement a rehabilitation plan based primarily on her gender, assuming female athletes typically respond to certain types of rehabilitation exercises more effectively than males for ankle injuries. The correct answer is B. Develop a comprehensive rehabilitation plan that specifically addresses the potential biomechanical compensations from her knee injuries, the altered proprioception and potential scar tissue from her previous ankle sprain, and considers her age-related healing and recovery timelines. Explanation: this scenario presents a common challenge in athletic training, integrating a patient's intrinsic factors into a comprehensive and individualized treatment plan. The difficulty lies in balancing the objective data gathered during assessment with the subjective history and unique characteristics of the individual. A failure to adequately consider age, gender, and previous injuries can lead to ineffective treatment, increased risk of re-injury, and potential ethical or regulatory breaches if the care provided falls below the expected standard of practice. The correct approach emphasizes a holistic evaluation that directly links intrinsic factors to the current presentation and future rehabilitation strategy. This aligns with the core principles of athletic training, which mandate individualized care and evidence-based practice. By considering how age might affect healing rates, how gender might influence biomechanics or hormonal responses, and how previous injuries create predispositions or compensatory patterns, the athletic trainer can develop a more targeted, effective, and safe intervention. This proactive and personalized approach is a hallmark of best professional practice, ensuring that the athlete's specific vulnerabilities and strengths are addressed. Incorrect approaches fail to adequately integrate these critical intrinsic factors. One incorrect approach might overlook the cumulative impact of previous injuries, treating the current issue in isolation. This is a regulatory failure because it deviates from the expectation of comprehensive patient assessment and management, potentially leading to suboptimal outcomes and a breach of the duty of care. Another incorrect approach might generalize treatment based solely on age or gender, without considering the individual's specific injury history or current condition. This is an ethical failure as it demonstrates a lack of individualized attention and can perpetuate stereotypes rather than addressing the athlete's unique needs. A third incorrect approach might focus exclusively on the acute injury, neglecting how intrinsic factors might predispose the athlete to future issues or influence their recovery trajectory. This represents a failure to adhere to best practices in injury prevention and long-term athlete development, which are integral to the scope of athletic training. The professional decision-making process for similar situations should begin with a thorough review of all assessment data, including objective findings and subjective reports. Crucially, the athletic trainer must then synthesize this information with the athlete's intrinsic characteristics. This involves asking critical questions. How does the athlete's age influence their recovery potential and exercise tolerance? Are there gender-specific considerations related to this injury or the athlete's biomechanics? What are the specific mechanisms and consequences of previous injuries, and how might they be contributing to the current problem or impacting rehabilitation? This analytical process allows for the development of a treatment plan that is not only responsive to the immediate injury, but also addresses the athlete's unique profile, promoting optimal recovery and long-term health. Question 17. Process analysis reveals that a high school football player, who is a returning starter, expresses a strong preference for a specific helmet model he used in previous seasons, citing its comfort and familiarity. However, the athletic department has recently updated its equipment policy to mandate the use of helmets that meet the latest NOC standards and have undergone a recent recertification process. The athletic trainer must now advise the player and coaching staff on appropriate helmet selection and fitting. Which of the following actions best represents the athletic trainer's professional responsibility in this situation? Option A. Ensure the player is fitted with a helmet that meets the current NOC standards and has been recertified according to the athletic department's updated policy, regardless of the player's previous model preference. Option B. Recommend a helmet that is aesthetically similar to the player's preferred model, even if it requires compromising on some of the latest safety features to appease the athlete's desire for a specific look. Option C. Prioritize the player's stated preference for his familiar helmet model, even if it means overlooking minor discrepancies with the latest NOC standards, to foster a positive athlete-coach relationship. Option D. Allow the player to continue using his preferred helmet model from previous seasons, assuming it has not shown any visible signs of damage, to maintain his comfort and confidence. The correct answer is A. Ensure the player is fitted with a helmet that meets the current NOC standards and has been recertified according to the athletic department's updated policy, regardless of the player's previous model preference. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers involving the selection and fitting of protective equipment, specifically helmets, for a student-athlete participating in a high-contact sport. The challenge lies in balancing the athlete's perceived comfort and performance needs with the paramount responsibility of ensuring adequate protection against potential injury, all within the framework of established safety standards and manufacturer guidelines. The AT must navigate potential pressure from the athlete, coach, or even parents, while adhering to their professional scope of practice and legal obligations. Correct approach analysis. The correct approach prioritizes the athlete's safety and well-being by selecting a helmet that meets or exceeds established safety standards for the specific sport and is properly fitted according to manufacturer instructions. This aligns with the fundamental ethical and legal responsibilities of an AT to provide competent care and minimize risk of harm. Adherence to standards e.g. NOC for football helmets and proper fitting protocols are critical to ensuring the helmet functions as intended during impact, thereby fulfilling the AT duty of care. This approach reflects best professional practice by grounding decisions in evidence-based guidelines and established safety protocols. Incorrect approaches analysis. Selecting a helmet solely based on the athlete's preference for a specific brand or aesthetic, without verifying its compliance with sport-specific safety standards, is a regulatory and ethical failure. This disregards the primary purpose of protective gear, which is to mitigate injury, and potentially exposes the athlete to undue risk, violates the AT duty to act in the athlete's best interest, and could be considered negligence. Choosing a helmet that is not properly fitted, even if it meets safety standards, is also a significant failure. Improper fit can compromise the helmet's ability to absorb impact, leading to increased risk of injury. This demonstrates a lack of diligence and competence in applying protective equipment protocols, failing to uphold the standard of care expected of an AT. Recommending a helmet that is outdated or has been previously used and potentially compromised, without thorough inspection and recertification according to manufacturer guidelines, is another critical failure. Such equipment may no longer provide adequate protection, and its use constitutes a breach of the AT responsibility to ensure the integrity and efficacy of protective gear. Professional reasoning. When faced with protective gear selection and fitting, it should employ a systematic decision-making process. This involves 1. Identifying the specific sport and associated risks. 2. Researching and understanding relevant safety standards and certifications, e.g., NOC ASTM. 3. Consulting manufacturer guidelines for proper fitting and maintenance of specific equipment. 4. Assessing the individual athlete's anatomy and needs. 5. Communicating clearly with the athlete, coach, and parents about the rationale behind equipment choices, emphasizing safety. 6. Documenting all decisions and actions related to protective equipment. This structured approach ensures that decisions are evidence-based, ethically sound, and legally defensible, prioritizing the athlete's safety above all else. Question 18. During the evaluation of an athlete recovering from a hamstring strain who reports feeling completely fine and eager to return to their sport, what is the most appropriate course of action for a certified athletic trainer AT to ensure safe and effective return to play? Option A. Administer a series of sport-specific functional performance tests to objectively assess strength, power, agility, and pain-free range of motion before clearing the athlete. Option B. Advise the athlete that they must wait a predetermined number of weeks, regardless of their current functional status, before returning to play. Option C. Defer the decision to the coach, who is best positioned to assess the athlete's readiness for competition. Option D. Clear the athlete for full participation immediately, as their subjective report indicates they are ready. Correct answer is A. Administer a series of sport-specific functional performance tests to objectively assess strength, power, agility, and pain-free range of motion before clearing the athlete. Explanation. Scenario analysis. This scenario presents a common challenge for certified athletic trainers in balancing an athlete's desire for immediate return to play with the necessity of a thorough, evidence-based rehabilitation process. The athlete's subjective report of feeling ready must be objectively assessed against established functional criteria and the potential risks of premature return, such as re-injury or exacerbation of the current condition. The AT must navigate the athlete's emotional state and performance pressures while adhering to professional standards of care and ensuring the athlete's long-term health and safety. Correct approach analysis. The correct approach emphasizes a systematic, objective assessment of functional readiness for return to sport. This aligns with the BOC Board of Certification, Standards of Practice and Ethical Code, which mandate it to provide care based on scientific evidence and to prioritize the athlete's well-being. Specific functional tests, such as HOP tests, agility drills, and sport-specific movements, are crucial for objectively measuring strength, power, proprioception, and pain-free movement necessary for safe participation. This approach ensures that the decision to clear an athlete is not based on subjective feelings alone, but on demonstrable functional capacity, thereby minimizing the risk of re-injury and upholding the professional responsibility. Incorrect approaches analysis. One incorrect approach involves clearing the athlete solely based on their subjective report of feeling good or ready. This fails to meet the standard of care because it neglects objective functional assessment, which is a cornerstone of evidence-based practice in athletic training. Ethically, it violates the principle of beneficence by potentially exposing the athlete to undue risk of re-injury. It also fails to adhere to the BOC's requirement for AT to make decisions based on objective findings and established criteria. Another incorrect approach is to clear the athlete based on a fixed timeline, e.g., it's been X weeks since the injury. This is problematic as healing and rehabilitation progress vary significantly between individuals and injury types. Relying on a predetermined timeline ignores the athlete's unique recovery trajectory and functional status, which is a deviation from best practice and potentially violates the AT duty to provide individualized care. This approach lacks the objective validation required by professional standards. A third incorrect approach is to clear the athlete based on the coach's or parents' pressure to return to play. While at work within a team environment, their primary ethical and professional obligation is to the athlete's health and safety. Succumbing to external pressure without adequate objective assessment compromises this obligation and can lead to detrimental outcomes for the athlete, including long-term disability or chronic pain. This action would be a clear breach of professional ethics and standards of care. Professional reasoning. When faced with an athlete eager to return to play, it should employ a structured decision-making process. This involves 1. Reviewing the initial injury assessment and rehabilitation plan. 2. Implementing a battery of objective functional tests relevant to the athlete's sport and injury. 3. Comparing the athlete's performance on these tests to normative data or pre-injury baseline measures. 4. Considering the athlete's subjective feedback in conjunction with objective findings. 5. Collaborating with the athlete, coach, and physician to make a shared, informed decision regarding return to play, clearly communicating the rationale and any necessary modifications or continued rehabilitation. This systematic approach ensures that decisions are evidence-based, ethically sound, and prioritize the athlete's long-term well-being. Question 19. The efficiency study reveals that a significant number of athletes experiencing persistent fatigue and localized muscle weakness after a specific type of impact injury are not responding optimally to standard rehabilitation protocols. Considering the critical role of the neuromuscular junction in muscle activation and force production, what is the most appropriate initial approach for an athletic trainer to take when assessing these athletes to improve treatment efficiency and efficacy? Option A. Focus solely on improving the athlete's overall cardiovascular fitness to compensate for perceived generalized weakness. Option B. Immediately escalate the athlete's care to a physician for a comprehensive neurological workup, assuming a severe underlying neurological condition. Option C. Conduct a detailed assessment of the neuromuscular junction's integrity and function, including evaluating the transmission of nerve impulses and the subsequent muscle fiber response, to identify potential disruptions. Option D. Implement a broad-spectrum stretching and strengthening program without further specific diagnostic investigation, based on the efficiency study's suggestion for faster intervention. The correct answer is C. Conduct a detailed assessment of the neuromuscular junction's integrity and function, including evaluating the transmission of nerve impulses and the subsequent muscle fiber response, to identify potential disruptions. Explanation. Scenario analysis. This scenario presents a common implementation challenge for athletic trainers at working within a specific regulatory framework, such as the NADA Code of Ethics and relevant state practice acts. The challenge lies in interpreting and applying knowledge of the nervous system, specifically the neuromuscular junction, to a practical situation involving a potential injury. The AT must balance immediate patient care with adherence to established protocols and scope of practice, ensuring that interventions are evidence-based and within their professional purview. The efficiency study adds a layer of complexity, suggesting a need to optimize assessment and treatment, but without compromising patient safety or diagnostic accuracy. Correct approach analysis. The correct approach prioritizes a thorough, systematic assessment of the neuromuscular junction's function, directly addressing the findings of the efficiency study by focusing on the most relevant physiological mechanisms. This aligns with best professional practice by utilizing the specialized knowledge to identify potential disruptions at the site of muscle activation. This approach is ethically and regulatorily sound as it adheres to the role in evaluating and managing neuromusculoskeletal injuries, ensuring that interventions are targeted and evidence-based, as mandated by the NADA Code of Ethics, e.g. Principle 1. Respect, dignity, and rights of individuals. Principle 2. Competence and professional development, and state practice acts that define the scope of athletic training. Incorrect approaches analysis. One incorrect approach might involve prematurely concluding a specific diagnosis without a comprehensive assessment of neuromuscular function. This could lead to inappropriate treatment, potentially delaying proper care, or even exacerbating the condition. This violates the ethical principle of providing competent care and could be outside the scope of practice if it involves diagnosing conditions beyond their training or expertise. Another incorrect approach could be to rely solely on subjective patient reports without objective physiological assessment. While subjective information is crucial, a thorough evaluation of the neuromuscular junction requires objective measures to confirm or refute hypotheses about nerve signal transmission and muscle response. Failure to conduct objective assessments can lead to misdiagnosis and ineffective treatment, contravening the responsibility to provide evidence-based care. A third incorrect approach might be to recommend interventions that are outside the scope of practice, such as prescribing medication or performing invasive diagnostic procedures. This directly violates regulatory frameworks that define the role and responsibilities, potentially leading to legal repercussions and compromising patient safety. Professional reasoning. When faced with such a scenario, an AT should employ a systematic decision-making process. First, they must clearly define the problem based on the efficiency study's findings and the patient's presentation. Second, they should access and apply their knowledge of neurophysiology, specifically the neuromuscular junction, to formulate differential diagnoses. Third, they must select and implement appropriate, evidence-based assessment techniques that fall within their scope of practice. Fourth, they should interpret the findings in conjunction with the patient's history and symptoms to arrive at a working diagnosis and develop a safe and effective treatment plan. Finally, they must document their findings and interventions meticulously, adhering to all regulatory and ethical guidelines. This process ensures patient safety, promotes optimal outcomes, and upholds the professional standards of athletic training. Question 20. Strategic planning requires an athletic trainer to proactively identify potential risks to an athlete's health and safety. When assessing a collegiate swimmer presenting with generalized fatigue and mild muscle soreness following a rigorous training week, which of the following approaches best demonstrates a comprehensive risk assessment strategy that prioritizes identifying red flags? Option A. Immediately recommending a period of rest and hydration, assuming the symptoms are solely due to overexertion without further investigation into underlying causes. Option B. Focusing primarily on the athlete's subjective report of fatigue and soreness, and initiating a standard recovery protocol based on these symptoms alone. Option C. Systematically reviewing the athlete's medical history for pre-existing conditions that could be exacerbated by their current symptoms, and then correlating this with reported symptoms and physical findings to identify potential red flags. Option D. Relying on the coach's assessment of the athlete's overall performance and energy levels to determine if further medical evaluation is necessary. The correct answer is C. Systematically reviewing the athlete's medical history for pre-existing conditions that could be exacerbated by their current symptoms, and then correlating this with reported symptoms and physical findings to identify potential red flags. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the athletic trainer to synthesize information from multiple sources: the athlete's reported symptoms, their medical history, and the physical examination findings to identify potential red flags that could indicate a serious underlying condition. The pressure to return the athlete to play quickly, coupled with the athlete's potential desire to downplay symptoms, necessitates a vigilant and systematic approach to risk assessment. Failure to identify a significant red flag can have severe consequences for the athlete's health and well-being and expose the athlete to liability. Correct approach analysis. The correct approach, which involves systematically reviewing the athlete's medical history for pre-existing conditions that could be exacerbated by their current injury or treatment, and then correlating this with reported symptoms and physical findings to identify potential red flags, represents best professional practice. This aligns with the National Athletic Trainers Association (NATA) Code of Ethics and Standards of Practice, which mandate that it provide competent care and act in the best interest of the athlete. Specifically, the responsibility to gather a thorough medical history is a foundational element of risk assessment and injury management, as outlined in the NATA practice-based competencies and clinical practice guidelines. Identifying red flags is a critical component of this, ensuring that serious conditions are not overlooked and that appropriate referrals are made promptly. Incorrect approach is analysis. One incorrect approach would be to solely focus on the immediate presenting symptoms and physical examination findings without delving into the athlete's comprehensive medical history. This fails to acknowledge that pre-existing conditions, e.g., a history of cardiac issues, sickle cell trait, or neurological disorders, can significantly alter the risk profile of an acute injury or illness. Ethically, this approach violates the principle of beneficence by not fully considering all factors that could impact the athlete's health. Regulationally, it falls short of the comprehensive patient assessment expected of it. Another incorrect approach would be to prioritize the athlete's subjective report of pain and functional limitations above all else, potentially overlooking objective signs or historical data that suggest a more serious underlying pathology. This can lead to a premature clearance for activity, ignoring potential red flags that might not be immediately apparent to the athlete. This approach is ethically problematic as it can lead to harm, non-maleficence, and is not in line with the duty of care. A third incorrect approach would be to rely solely on the recommendations of coaches or parents regarding the athlete's readiness to return to play, without conducting an independent and thorough risk assessment. While collaboration is important, the professional judgment and responsibility for athlete safety must take precedence. This approach abdicates the professional responsibility and can lead to significant ethical and regulatory breaches, as the is ultimately accountable for the athlete's well-being under their care. Professional reasoning. Professionals should employ a systematic approach to risk assessment that begins with a comprehensive understanding of the athlete's medical history. This history should be reviewed for any pre-existing conditions, allergies, previous injuries, or family history that could be relevant. This information should then be integrated with the athlete's current symptoms and the findings from a thorough physical examination. The should be trained to recognize common red flags associated with various conditions, e.g., neurological deficits, signs of infection, cardiovascular abnormalities, or psychological distress. If any red flags are identified, the must follow established protocols for referral to appropriate medical professionals and ensure the athlete's condition is managed appropriately before considering a return to activity. This decision-making process is iterative and requires continuous reassessment.